this is a QEEG. You know what those are?
Yes,
QEEG.
but maybe explain them for people.
So this is a measure of the voltage inside the brain. So high voltage is a disorganized thought process, and it's red. And normal brain function is green and yellow. Okay. So we have the patient like this. We did the QEEG when they have cognitive issues before we put the amphotericin in the sinus, and then this is after we put the amphotericin in the sinus. So that they're given a history that their brain cleared. What I wanted to see what that looked like on a QEEG, you can see it really does change the voltage in the brain. And so red and orange is all high voltage and disorganized thought process. So that's pretty dramatic, isn't it?
That's
You know,
incredible.
so 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 this is called a P300. Now that's a hearing test where you test the time it takes for the sound to get from the eardrum into the brain. So normal hearing time is 300 milliseconds. Well, these people are 400, 500, and this particular individual has no response. Because I notice in the patients, when you're talking to them, uh, if they're not writing down what you're saying, telling them, they don't get it because their brain never heard it. See, so these
Oh,
when the green and red lines cross, the brain has then heard the sound. Okay, well these never crossed. So this person is hearing the noise, but they're not processing anything. All right. So then this one has a 461 of 300. So they're crossing way out here. So we found out that if we're not having these patients write down their instructions, they don't own it and they don't follow up. So you could give it to them all printed out nicely in a paper. They don't own it then. They only own it when they write it. So we have them write it down.
wow.
So so now this one is all this is tissue that we took out of the sinus, and all this brown halo is mycotoxins. And this is what the toxins that were in this tissue, aflatoxin, ochratoxin in this tissue, and it was both in the tissue and in the halo. So the same mycotoxin is leaching out of the tissue. So now we don't have to keep assaying the brown halo because we know it's mycotoxins. Okay. So this is what CT looks like. This is the tissue that contains all the mycotoxins and the most spores. And then this is what this patient had to say. She didn't want her face on there, so
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
okay, so
Oh,
how many millions of people are out there
yeah.
that, that have psychiatric issues, And so this is just an example. Uh, and her sinus x-ray is not that bad, but she really needed the surgery. And what you do is you do all the medication, get them out of the environment. If they don't improve their scores, their cognition score and their energy level, and they still have a large amount of mycotoxins in their urine, they need surgery, which removes all that. So, and this is that same patient that you just saw. This is before surgery. All this red stuff is disorganized thought processes and brain damage. All right. So this is after surgery. It's much better after surgery, but it's not clear. Now, this is after neurotherapy. So a lot of these people need neurotherapy after surgery to get the rest of it cleared up.
What's
So
neurotherapy?
uh, it's passive. It's like you're putting electrodes on the head. to
Mhm.
measure the brain waves, and then the computer knows what normal brain waves are supposed to look like. So it shows a movie, and then the brain gets engaged in watching the movie, and then the movie turns off.
Mm.
So the brain starts making all the waves it knows how to make until the movie reappears, which is the correct wave, see? So it's getting rewarded by doing the right thing. So the brain's getting rewarded to see the picture, and then it stays on the correct frequency. See what I mean?
Yep. Interesting.
And then you keep doing that, so you retrain the brain. And it takes about 3 months or so to do that. And you work with it, about an hour a day is passive, and you can do it at home.
Is that
But
similar to neuroplasticity, retraining the brain?
yeah, you're
Looking over a
retraining the
bear?
brain. This is from brain injury,
Hmm.
and you're retraining the brain, and they get a lot better. And then some people have they think they're still in Mo, and they're really not. And they throw all their clothes away and move to another hotel room. And they keep doing that because of the brain damage.
Mm.
And if you don't fix the brain damage, you can't change the behavior. So that eventually they just empty their wallet and they never get any better. So
Hmm.
you got to know what's happening in the brain, and also that when you do a tap test on their clothing, you know that they're in a safe place because they don't have many colonies in their clothes. See, so that's what
Mm.
we do.